Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon, everyone. We are still seeing a lot of influenza around the country, but we are seeing increasing amounts of vaccine. Today I want to touch on three areas briefly: flu activity and illness around the country, the vaccine supply and distribution, both for H1N1 and for seasonal influenza vaccine, and provide a few tips for holiday travel, and then, of course, take a lot of time to answer your questions. We are beginning to see some declines in influenza activity around the country, but there is still a lot of influenza everywhere. 43 states are reporting widespread activity. That's down from 46 last week, but it's still much greater than we would ever see at this time of year. This past week, 21 influenza-associated pediatric deaths were reported to us. 15 of those were confirmed to be due to H1N1, the 2009 H1N1 strain. 6 of them were influenza A, but the additional typing hadn't been done, but they're pretty likely to have also been from this new strain. That means we're up to 171 H1N1 influenza deaths in children that are laboratory confirmed. Of course, as we've been saying, this is just a partial counting. We believe the estimates that we provided last week give a better picture of the full toll that the virus had taken in the first 6 months of the pandemic, and in a few weeks we'll be updating those estimates further. Overall, about 2/3 of children who've died from influenza this season have had an underlying condition like asthma or neurologic problems like cerebral palsy or muscular dystrophy, and about 1/3 have not. The level of influenza activity we're seeing right now remains high. Even though we saw a little bit of a decrease this week, it is still higher than the peak activity in many years. We can't predict exactly what's going to happen over the weeks or months ahead. As we've been saying, influenza season typically goes from December to May. Nothing is typical about this year's influenza. We may have weeks and months of a lot of disease ahead of us. Our expectation is that the next several weeks will be busy ones. As people increase traveling over the holidays, we may see mixing of strains around the country, and of course I'll be reminding you some tips for travel later on. The H1N1 vaccine supply continues to increase. We're not where we want to be, but available vaccine is being quickly ordered and shipped, and we are in better shape today than we were a couple weeks ago. Specifically today, 54.1 million doses of H1N1 vaccine have become available for the states to order. That's a cumulative total for the season so far. That number is 11 million doses more than we were at a week ago. As of Wednesday, 93% of the vaccine that was available to order had been ordered by the states. So we think that the states are very rapidly keeping up with the new doses that become available, and of course those new doses are getting ordered and then shipped out where they are promptly being used by providers and venues around the country. I also want to update the seasonal flu vaccine distribution and just remind folks this is managed by the private sector, but the manufacturers have let us know that as of last Friday, 94.5 million doses of seasonal influenza vaccine had been distributed around the country. Let me turn to prevention during this holiday season. Flu is throughout the country, but it is not necessarily in every single community or family. And as families gather over the holidays and get together from different parts of the country, we might see an increase in influenza or other infectious disease activities. But there's a lot everyone, all of us, can do to reduce the spread of flu. Because of the holiday season and the increase in travel that we're really expecting over the next few weeks, CDC has just launched a new travel health campaign. Our campaign is designed to highlight 4 basic steps that everybody can take to be healthy this holiday season. The first step is to travel well. That means travel only when you are well. The second is to wash your hands often. That can be with soap and water, or it can be with alcohol-based hand sanitizer. The third is to cover your cough and sneeze with tissues or with your sleeve. And the fourth is to get vaccinated against flu, particularly if you're in a targeted population. If you're in one of the groups recommended for flu vaccine, either the seasonal flu vaccine or the H1N1, we hope you'll be staying informed about where you could be vaccinated in your community over the weeks ahead. By practicing prevention, we hope everyone can enjoy the holidays and enjoy getting together, and it's just a reinforcement of how important these simple steps each of us can take are. In closing, before we get to questions, I just want to say how sorry I am that people have been so frustrated, that people have had to wait in lines, that people haven't always found vaccine at the end of the lines. I wish that things had been and that they will go smoother. The public health system, the frontline local and state health departments, and the healthcare providers caring for patients and offering vaccine are working really hard this fall, and I thank all of them for the hard work they have been carrying out to make sure that vaccine, as it does become available, is quickly administered to the people in the priority groups. I'm glad to see that vaccine is becoming more available and that it's promptly being used when it is available. And I, again, just want to thank everyone at that front line for the incredible work they're doing and apologize for the frustration that the public has been experiencing. I hope we're going to be able to build on the progress in the weeks ahead, and now I want to turn to people's questions. I think we can start with one in the room. Mike?
Thanks.
Sure.
Hi, Dr. Mike Stobie from the AP. Two questions. Do you have any data on how many swine flu vaccine doses have been administered so far? And also, could you tell us a little more about the decline in infections? Is it true across the nation? Are there any places in the country where there seems to be heightened activity lately?
Mm-hmm. Thanks. We are carrying out coverage surveys where we'll be able to estimate how many doses have been administered, and we're looking forward to sharing that in the weeks ahead. One thing I can say from our preliminary analysis is that about half of the doses that have been given to children, and the vast majority of the doses that have been given have been going to people who self-identify as in one of those priority groups. In terms of the disease activity, that's a great question. We've been trying to remind people that influenza is local. All 10 regions of the country are starting to see a decrease in the average influenza-like activity, but there are several states where things are still increasing, or they increased this past week versus the week before. States like Maine and Hawaii saw increases this past week over the week earlier. So just to say that the national average looks a little lower this week, or that all 10 regions now are seeing a decline, doesn't mean that in every state or in every community it's a little better this week than the week before. If we look over influenza seasons in the past, there can be multiple ups and downs over the season. So what I believe is the case is that we have many weeks ahead of us where disease is circulating. And again, even if things do get better and better over the next several weeks, we look again at that 1957 experience where after the first of the year, a second wave of mortality occurred. So a variable picture, but a little better this week than the week before overall.
And our first question is from Rob Stein, Washington Post. Your line is open.
Yeah, hi. Thanks very much for taking my questions. I had two questions, really. First one was, I know you don't know for sure, but I'm wondering if you think we might have hit the peak with this wave and will be on the way down. And then the second question was, I was wondering if you could tell us anything about this report out of Norway about this mutation in the virus.
I wish I knew if we had hit the peak. What I can say is that even when a peak has occurred, half of the people who are going to become ill haven't gotten ill yet, and that a peak of influenza-like activity in the outpatient setting doesn't mean the same thing as a peak in hospitalizations and deaths. We often see a lag in the latter two indicators. The key thing that I need to say is influenza is unpredictable, and it is so early in the year to have this much disease. We don't know even We don't know if these declines will persist, what the slope of the decline will be, whether we'll have a long decline, a lot of bumps, or it'll start to go up again. So I think this is why it's just so important that we take the basic steps of prevention, each of us, washing our hands, covering our cough and sneeze, staying home when we're ill, and then also for priority populations, taking advantage of vaccine when it's available in your communities. Your second question was about Norway, and we are aware of reports from Norway of an unusual virus that was identified, a mutation in a few virus isolates. I don't want to underplay that result because it's so important for us to track influenza viruses carefully, to look at them genetically for changes in virulence or for changes in their immune properties. What I can say is the mutation that was identified has no implications for how good the match of the vaccine is, and it has no implication for treatment with antiviral medicines, but it's important for us to continue to track influenza viruses and look for changes. So we would look for things like spread of that particular mutation and whether in large numbers it was associated with more virulent disease. And so I think we appreciate Norway reporting what they found.